And thank you all for joining us this afternoon. We have a very distinguished and diverse panel to discuss workforce development, and that is such a broad topic. We hope to be able to cover aspects of that in the next 45 to 50 minutes or so. And we've specifically selected representatives from across the spectrum. We have representation from the provider community, from public health, from the CDC, higher education, regional extension centers, and as the previous backgrounds, there's also experience represented from health information exchanges, as well as healthcare solutions and consulting firms. I'm going to provide a very brief bio for each of the panelists so we can spend more time hearing from them and hopefully getting some good questions from you as well. I will ask each panelist to spend just a few minutes up front talking about his or her view of the dynamic workforce needs in their particular areas, perhaps some of the challenges and things they're dealing with. I will then start off asking the panel a few questions, and then I would really encourage lots of questions from the audience. So, once we get into this, if you have questions, there's not a microphone to be passed around, so if you have questions, please raise your hand, and I'll break from mine and turn things over to you. And finally, at the very end, I'd like to spend about 5 minutes, the last 5 minutes, just asking each of the panelists to share with us, a final thought, recommendation, kind of a call to action. So without that, let's get going here. First, closest to me, we have Dr. Mohamed Ghavi. He is the CEO at Consort Systems and Consort Institute. Dr. Ghavi's background includes a broad spectrum of successful scientific, education, and entrepreneurial accomplishments, including the role as founder of several highly successful companies. One of these companies, Consort Technologies, played a key role in the pioneering development of open electronic health record systems in the early 1990s. After acquisition of Consort Technologies, Dr. Ghavi founded Consort Systems and Consort Institute, two companies that specialize in providing consulting and educational services to the healthcare industry. Dr. Ghavi is also actively involved in leadership of two advanced studies at Southern Polytechnical State University, where he's a faculty member. Next to Dr. Ghavi is Dr. Denise Hines. Dr. Denise Hines is the Director of Marketing, Education, and Outreach for the Georgia HIT Regional Extension Center. Dr. Hines possesses over 23 years of extensive and varied experience in different healthcare organizations. During Dr. Hines participated in the Georgia's HIE Strategic and Operational Plan team and served as the co-chair of the HIE Governance Committee. She successfully launched Georgia's first comprehensive health information transparency and health information exchange website. She served as the first executive director for the Georgia HIT Advisory Board and created Georgia's 2-, 5-, and 10-year strategic plans for healthcare information technology. Dr. Hines holds her doctorate in healthcare administration, where she focused her studies on the use of electronic personal health records and the impact on patient health. She is also currently serving as the president of the Georgia chapter of HIMSS. Next to Dr. Hines is Allana Cummings. She's the CIO at Northeast Georgia Health Systems in Gainesville, Georgia, where she oversees the information technology, clinical informatics, and telecommunications departments. Allana has served as the CIO since March of 2010. Prior to joining the Northeast Georgia team, she served as the Vice President and Chief Information Officer at Children's in Omaha. During Allana's career, the teams she has worked with have received national recognition for their efforts in implementing electronic medical records and other technologies to advance the safety of patient care. And beside Allana is Dr. Seth Fody. Dr. Fody is the Director of Center for Disease Control and Prevention, or the CDC, Public Health Informatics and Technology Program Office. Previously, he practiced and taught family medicine and served as the Health Commissioner of Milwaukee and as the State Health Officer of Wisconsin. Dr. Fody co-founded the Wisconsin Health Information Exchange and served on the boards of the eHealth Initiative, National eHealth Collaborative, and the State Alliance for eHealth. His explorations of informatics solutions helped earn him the Romer Prize for Creative Local Public Health Work. Wisconsin earned the Davies Prize for Excellence in Public Health Information Systems under Dr. Fody's leadership. So as you can see, we have quite a successful panel here. So if I'm just going to go down the list of tables. So Dr. Ghavi, if you would just spend a few minutes and reflect on your areas.
Thank you. The subject for this module, of course, is workforce development. And that is an area that I have personally been sort of involved with it, dealing with it. First as a executive of an organization that very much was in need of personnel to be able to help us with the unique needs of healthcare informatics, both in terms of system development as well as implementation and consulting and training. It was really that background that enticed me to get involved with the Southern Polytechnic State University here in Atlanta to develop a program that spoke directly to the needs of the healthcare informatics for the healthcare industry. The issues that I'm hoping we can discuss a little bit this afternoon is that workforce development for health information technology doesn't just involve development of some simple curriculum that is based on some theoretical knowledge or passing knowledge on to the students. What we have learned is that an effective program is a three-legged stool. And one leg of it, of course, has to do with the theoretical knowledge and information. But the second leg also has to do with the fact that it is not enough to teach the individuals to talk the walk, but you also need to teach them to walk the talk. And as such, it is extremely important to make sure that as part of a successful workforce development training program, you have hands-on programs that basically provides a sort of a background and practical knowledge for the workforce. And the third element has to do with the fact, for those of us who have dealt with the field of healthcare, is that healthcare is a unique industry. It has its own culture, it has its own wants, needs, and issues. And if we are to train successful entrants into this field, it is extremely important to also train the applicants and people who are interested in entering the workforce for healthcare about the specific culture of the healthcare. So not only they need to learn to talk the walk, they also need to be taught and learn how to walk the talk, but they also need to be able to communicate with those who do the talking, and when they also do the talking, be able to communicate with the audience. And so it's a unique training environment, and that's what makes it so challenging and so interesting at the same time. And we're delighted that in partnership with Southern Polytechnic State University, we have been able to put a training program that has proven successful on both sides, both on the individuals who are looking to get in and those who have taken a chance on our students and have hired them.
Terrific, thank you. Dr. Hines.
Well, good afternoon. As Peter mentioned, I am wearing a couple of hats today. My first hat, I serve as the Director of Education and Outreach for the Georgia Health Information Technology Regional Extension Center. The Regional Extension Center is founded out of Morehouse School of Medicine's National Center for Primary Care. We were awarded a $20 million grant from the Office of the National Coordinator. Our role is to work with over 5,200 primary care providers and 56 critical access and rural hospitals. We help our providers select, implement, and use certified EHR so that they can qualify for the Meaningful Use Incentive programs. So to date, we've helped over 3,000 providers and over 30 critical access and rural hospitals over our program is a 4-year program. In our work, we work very closely with the Atlanta Technical College, who was awarded the federal grant for the Community College Consortia. And in that program, they created curriculum to allow professionals to become certified in health information technology. So if you have health professionals who do not have experience on the IT side, that is a great program for them to consider. And if you have IT professionals who do not have experience on the healthcare side, that is another program for them to consider. The program has, the Georgia program has proven to be the most successful across the nation with over 400 students enrolling in the program. It's a grant-funded program, so it's relatively inexpensive for the students. They pay a cost up front and then they're reimbursed at the end. So we work closely with Allana Technical College. We've allowed several interns from the Technical College to work with us at the Regional Extension Center. And those students have gained experience in working with providers, learning workflow, learning implementation, learning learning to talk with vendors, EHR vendors, arranging demonstrations for our providers who need access to certified systems. So we've become a training ground for several interns. We're also partnered with organizations such as Southern Polytech to use some students who will also come out and help us with gap analysis for the critical access in rural hospitals. So we've closely worked with several of the colleges who are developing the students and working professionals. And really what we found with the Allana Technical College program is that they aren't students who are just fresh out of college. These are professionals who are using or making HIT their second career. So we've been pleasantly surprised with the level of professionalism, the level of experience that the interns are coming over with to help us in our program. The second hat that I'm wearing is president of Georgia HIMSS, and HIMSS is the Health Information Management System Society. It is the largest health IT organization across the nation. Here in Georgia, we have over 1,600 members. In my presidency this year, we are starting a new scholarship program that I'm happy to announce. We will be posting within the next month, or actually probably within the next couple of weeks, where we will help promote and fund education for students who are interested in health IT. We are also working with several vendors who will work with us to offer internships to our Georgia HIMSS members to gain experience, and we've already signed up about 5 vendors who are willing to offer programs to work with our members. And HIMSS is the organization to begin networking if you are new to the HIT industry and you need an introduction to people and HIT professionals who have been in the industry for a while. We have events that allow our members to come by and get to know other people in the HIT industry. So several hats today, and I'll be speaking on the different perspectives as we talk about the opportunities and resources available to HIT professionals.
Great, thank you, Dr. Hines. Allana.
From a provider's perspective, it's certainly a very exciting time to be involved in healthcare IT. Dr. Hines made a great point. You've got people who are actually looking at second careers and moving to health IT as a way to be able to either wed their experience perhaps in some related field to healthcare, folks who are very mission driven and looking for those opportunities to really feel like they can make a difference. So we've been very fortunate. There are challenges in finding individuals that have the ideal skill sets and experience of both having worked in healthcare and having strong IT backgrounds, great knowledge about information management. And instead of kind of looking for the perfect candidates and maybe falling short, we've chosen some paths of looking at building a more diverse workforce and taking advantage of the fact that there are great educational and career advancement opportunities from a variety of areas where we can take people who have what I would call core skill sets that are very beneficial in our roles and then build the competency where perhaps there are some gaps. I thought it might be helpful just to share a little bit about the diversity of our workforce, just to give you some ideas and ways that we're thinking maybe differently than we have in the past about how to fill roles. From a traditional standpoint, we have 2 MDs that are part of our IT team, one serving in a full-time clinical role as Chief Medical Informatics Officer. We have 12 RNs, nurse practitioners, 6 certified project management professionals, and 35 individuals who have bachelor's degrees or master's degrees in IT-related fields. Those are the traditional individuals. But we also have an actor, teachers, law enforcement officer, entrepreneurs who own businesses, sales executives, who all come from a very diverse background and bring skill sets that not only complement what's needed on our team, but have actually helped us advance some of our ability to connect with our customers in a way that we haven't before, where we really are able to better understand the why and the how to help clinicians and other professionals within our organization use IT to its fullest. So I'm very excited to hear about the programs and the opportunities and the way that throughout the state we're supporting advancing healthcare IT professionals and the ability to fill these very critical roles.
Thank you. Dr. Foldy.
Well, all I can say is the workforce situation has got to be very dire if you're going to spend this long indoors on such a beautiful day to deal with it. In some regards, I'm speaking to you from the other side of the mirror. The Meaningful Use Incentive Program, of course, is spending several years getting health information technology into medical practices. But a large part of that initiative over time is the building of information exchange with other entities, and increasingly foreign entities such as public health. So, for example, just in the first year of the Meaningful Use Incentives, I know that some of you are already dealing with trying to figure out how to connect with local or state health departments around immunization reporting, syndromic surveillance reporting, communicable disease laboratory result reporting. And so that's what I refer to as the other side of the mirror. And although we may have gone first, of course, we will be followed by others, the skilled nursing care industry, the home care industry, and industries probably that have yet to be invented will also be health information exchange partners with those of you working from the clinical sector. So in the situation, it was said at the policy forum that many doctors are saying, well, this is the best possible thing at the worst possible time, given some of the stresses of the recession on their practice. In public health, it's probably even more acute, where government spending is dropping like a rock, and yet we are trying our best to connect to the healthcare sector, but of course we are not getting HIT incentives to do so. So there is a bit of a giant sucking sound from the perspective of public health as we see the workforce being sucked off and into the clinical sector, which has a very strong economic incentive to bring them on. Now, in the local and state health departments, which is where most of the information is getting used most quickly, real time, to actually help your doctors and nurses and also prevent disease in your communities, it's often a very difficult scene. Many of the information technology experts in those fields are nurses or epidemiologists or others who have made a hobby out of this and are doing their best to keep up in a world that is changing far faster than they can hope to, really. In many of those shops also, there are centralized IT government agencies that are supposed to provide the necessary support to a public health department. And of course, those kinds of centralized government IT shops are very rarely truly keeping up with the complexities of things like clinical health information exchange and meaningful use rules. So they have an enormous challenge that needs to be met. Even in my position at a federal agency, of course, we have our own budgetary, we're from an era of federal dollars to deficit reduction, of course. I'm working with a workforce that is used to federal IT, big IT, and that is now having to make the transition to understanding healthcare IT and what is the problem that state and local health departments are having connecting with small primary care practices or critical care hospitals. Public health is moving from dozens of information exchange partners to hundreds of thousands of information exchange partners over the next few years. So the job is considerable. So that both the federal and the state public health sectors, and again, probably reflecting many other sectors in the future as we move deeper into health information exchange across organizations, are facing the need, first of all, of retooling their existing workforce. There's really not much point in our dreaming of bringing on huge numbers of new people. We actually need people who have their old public health skills and that need to acquire new informatics skills. We also need to be able to continue to use and attract people who have various degrees of information technology training, but who need to better understand the world of the clinical public health interaction and, frankly, the world of clinical care. So that continuing education is definitely going to be a major factor going forward, no matter what. We've done a number of things at CDC. We've been holding meaningful use base camps. We've probably trained several hundred face-to-face, and of course are putting that learning out online as well for the public health professionals. Our annual Public Health Informatics Conference, which has been in Atlanta each year, in part to make sure the CDC workforce can get there. is actually at risk next year. We're not sure how we're going to support it. CDC is cutting back drastically on their conferencing capabilities. But this year, we served more than 1,000 people face-to-face and more than 1,200 others who participated in a virtual conference. So if you're interested in helping us figure out how to have conferences, even if it's not truly a federal conference, we might be interested in talking to you about that. Looking forward, I think that just as many people are doing health IT for the first time, the field is going to keep shifting. The target is going to keep shifting. And what I would do if I were looking to train a large number of workers is I would really focus on a few key things. First of all, interoperability. Interoperability more than any particular in-home concept. Secure transport, the vocabulary and semantic harmonization needed for interoperability and standards. Those are going to be key areas for education going forward. Second, to respect the workflow. But increasingly, it's not going to be the workflow of your organization, it will be the workflow of your organization dealing with the workflow of a very different organization. Again, public health department, a skilled nursing facility or others. They're going to have to be listening to two workforces, two sets of requirements at the same time. And finally, continuing education. Thank you.
Thank you. I'm quite a great perspective from all of you, and you just kind of ended with a whole list of characteristics of things that you're looking for in the workforce. A CIO roundtable was held yesterday. I think some of you participated, and I'm not sure if somebody else in the audience participated, but a conversation came up around the different needs between rural organizations and those in the metropolitan area. And Dr. Hines, perhaps, in your experience, what are you seeing as the difference between those in the rural environments, those in metro, and from a workforce development standpoint, what are we doing?
Right. We're already seeing a shortage of skilled HIT professionals, particularly if you look at, I'll use Piedmont for example. They just recently had a need for over 120 skilled HIT professionals because they're changing their hospital implementation. And they're just one example of an organization, as many others are, having to implement new systems, upgrade systems, and they need the skilled HIT professionals. And that's here in the Atlanta area, where it's attractive to live here. You have, of course, numerous resources around us in the Atlanta area. So when we look at the critical access in the rural hospitals, they're competing to get some of the same resources. So how do they attract skilled HIT people to come to South Georgia? How do you attract someone to go to Macon and work in other areas that are not considered the Atlanta area? And that's the biggest challenge I'm seeing when we work with some of our rural providers, that one, they may not be able to be competitive with salaries. And as one of our other providers, our physician provider, talked about in the public policy panel, they may not have the resources to hire IT staff. So how do they deal with those types of issues? And again, it's about finding those resources that are available to them. And in our role at the Regional Extension Center, we become an extension of their IT organization. We do help them coordinate demos with the vendors. We help them with their implementation with the vendors. And it's a free resource to those providers in primary care. So we're filling a gap there for our rural and critical access hospitals. But it's definitely a challenge for them to find the skilled HIT professionals and be able to afford them and keep them there.
Yeah. And Dr. Gabby, I know when we spoke a few weeks back, you mentioned that you also have kind of a passion for the rural. Can you talk from both the Southern Poly perspective as well as consort systems and how you're approaching that?
Exactly. We, as it was mentioned, the issue of healthcare IT workforce becomes specifically of great importance to rural facilities where they do not have resources to compete with urban facilities. So, quite frankly, when one looks at their situation, we've come to the conclusion that you cannot just throw money at it. You cannot look to the government to come up with additional funding for these rural healthcare facilities, in addition to what they already have budgeted for them to be able to help them. And let's say they help them for a short period of time, what's going to happen in the long term? So there's got to be a long-term solution for them. And thinking along those lines, we have actually implemented a program that we have implemented at a number of facilities in Georgia and has been quite successful, and that is the partnership between the rural healthcare facilities, either the community colleges in their area, or in cases where they don't have such a relationship, establishing a relationship with educational facilities like Southern Polytechnic University in Atlanta. Whereas what we do as we train our students, both in our undergraduate program, master's program, as well as our accelerated training program, which is a 10-week-long training program, we basically place our students, or at least make our students available to take internship position at these rural facilities. And by doing so, you have a win-win situation. On one hand, you're making IT professionals, because most of our students, those who are going through the BS or the master's program, have IT background, and those who are participating in our 10-week-long program, these are individuals who have IT background, and we basically help them learn about the healthcare IT issues and bring them up to speed to a healthcare IT profession. These individuals then become available to go and work as interns, so they get their feet wet, and they get a sort of hands-on education. And it actually, this process sort of helps them reinforce the hands-on training that we give them during the actual 10-week program here in Atlanta. So that's part of it. The other part of it is that we've come to the conclusion that some of these, especially remote facilities, have no choice but to pool their resources, and especially with the proliferation of internet, it is able to provide remote service to these facilities. The question is, who is going to provide these remote services? And again, through partnership with the educational institution, there is a possibility that these remote healthcare facilities can actually receive almost free support services through these programs that we're putting together at the universities and local colleges for this particular profession. The idea is getting to the practitioners of the healthcare industry in remote facilities to communicate and talk about their needs to the educational organizations that have the capabilities to reach out and help them.
You know, it's tremendous. I mean, what I'm hearing a lot of is not just, talk, there's a lot of action going on, and there are lots of programs. Denise, you're about, Dr. Hines, you're going to be announcing some new programs and things. Dr. Gav, you've got some great, suggestions also. I know this morning, in the morning panel, when Harry Reynolds was talking, he was talking about collaboration, right, and figuring out who you're going to do things with, and I think what we're hearing is, you are reaching out, you are, reaching across, some traditional, non-traditional lines and providing services, and I think it would be great to make sure that we have good communication channels, that these stories exist, that there is some hope for those rural people that do not have staff. Even the metro areas are, concerned about the staff they have to get all the work done that's happening right now. And Allana, you are also already doing some actual things for some of your people in your communities.
Sure. We've really reached out to collaborate with other organizations, whether it be a physician's practice or working with other healthcare facilities. One of the challenges in particular for the rural organizations is they're doing the same thing we are in large organizations. Implementing an EMR is implementing an EMR. And so I think sometimes where we maybe have forged ahead at maybe a different pace, being able to share lessons learned, being able to contribute some ideas, and then also sometimes just taking advantage and leveraging our relationships with the vendors and others to help those organizations has been really key. So we've tried to have a very open approach, not only to sharing what we know, but also learning from others. Certainly as we're challenged to do more and be more efficient in what we're doing. We're learning a lot from our partners in those rural areas who have very small staff but are highly successful in implementing these technologies. So I think those open lines of communication and sharing, and as it's been shared, really our roles are changing. No longer is a CIO over a health system interested in how to support a hospital and maybe in a physician's practice. It's how to be able to reach out across the community, and that also includes working with patients. So thinking about things outside of traditional healthcare, patient convenience portals, ways to have patients interact with their healthcare providers more effectively. Our world is changing, and so our skilled professionals today, unless they continue to keep the pace with where we're going, we really have to continue to stay on top of things and evolving what the educational opportunities ongoing and for new individuals entering the market, so that we do keep people who can really help support where we need to go.
Good, thank you. Before I've got lots of things that have sparked more questions for me, but I'd like to turn to the audience and see if anybody has a question. There's one in the back. And there's no microphone, so please come forward and speak loudly.
Actually, I'd just like to draw out a theme that I'm hearing across the panel, which is going it alone today isn't the practical strategy. Going to scale is the practical strategy. Everybody is sharing what they've got. There's always hazard there. There's friction. It's harder. But there's just not enough resources to go around. So I think what we're hearing is organizations are finding a way to share scarce commodities. Of course, the concept of state health information exchange services is another approach to that. I think that many, for example, many health departments are hoping, some might say praying, that state or regional health information exchange services will simplify for them the work of moving fairly high volumes of messages back and forth between organizations. Yeah. So going to scale is what I'm hearing.
Thank you. The question?
Yes, Bonnie Green, SEIC. My question is, as we all in this industry really understand the issue of the shortage of resources, in my personal experience, I think part of the issue as well is that there is still a major disconnection in terms of where the resources reside culturally and how they look for job opportunities and how we as our industry look for those resources. We've had several conversations with many of you on the panel talking about this issue, whether it's minorities or other individuals in rural communities, and there are pockets of folks, in my personal experience, that are really looking for new job opportunities to be retooled in IT, wanting to have a passion for healthcare, even doctors who want to change the profession from being clinical providers to becoming more of a consultant IT. And I still believe that we have a disconnect in terms of how we reach to them and how they know how to reach to us. You know, as we were talking, as one of those examples, you know, my experience in the African American community, many of them turn to their churches for that outreach of how to go find a job. And I know we're not reaching out to churches. You know, so I think there is, as we explore this issue, we're going to have to come outside of our traditional boundaries and think of where these constituent groups that may be able to solve our resource issues may reside, and it may not be in the traditional sense that we tend to consider.
Dr. Haynes?
I'm going to recommend that if you are looking for a new opportunity, networking should be your #1 priority. I think most of us who have been hired in positions that are favorable for us have been hired because we knew someone who could introduce us to someone else who could introduce us to the right people. So networking, to me, in my experience, has been the #1 asset to finding a new opportunity. The second thing I would recommend is that you position yourself to be visible. I know many of you are here today to meet other people, but the more we see the same people over and over again, the more we want to get to know you and find out what's your background, what do you do, what are you interested in. And I think just, again, networking and being visible in the right places at HIT summits, HIT meetings, the Georgia HIMSS meetings to meet other HIT professionals is really the best place to start, in my opinion. In my work with the vendors and talking with them about hiring people who are not traditionally at the levels where they would normally hire, they are now willing to accept people who are less skilled, less experienced in HIT to fill those positions. I know we just recently read the article about Greenway hiring 300 people. And in talking with some leaders at Greenway, are you willing to hire people who are less skilled? And the answer is yes. They do realize that the highly skilled HIT people are working. So the vendors are now considering hiring less skilled, lowering the experience requirements. And in my role, I find it one of my personal missions to talk with vendors and personally connect people that I know of who are looking for positions who would be good fits. And I just find that as something I can give back to my community, back to my profession, to help anyone that I can who is skilled to find a position, along with what we're doing at Georgia HIMSS, working with several of the colleges, working with other HIT professionals who are willing to participate in Georgia HIMSS and work with us. We want to introduce them to other opportunities and vendors. The other opportunity that's happening with colleges is that they are partnering with vendors. For example, Greenway is in the process of starting a lab that will allow several of the students to go to their lab and begin to get experience on the Greenway system. And that allows them to get experience on an EHR, so when they're ready to emerge into the workplace, they have hands-on experience with an EHR. So it's learning about those opportunities, talking to the right people, talking to vendors, talking to anyone that you can to find out what's going on in the industry, and really definitely positioning yourself to be in the right place at the right time.
Gabby, did you want to comment?
Yes. In addition to all, I agree with everything you said, and they all make sense. I think we need to consider the fact that healthcare is the intersection of IT and healthcare. And a lot of these people who are searching for position, we have a surplus of IT personnel. It just happens that we don't have enough skilled healthcare IT personnel. So more than half of the problem, quite honestly, has already been taken care of in the fact that people are out there who have IT capabilities. So the challenge is on the rest of us to come up with programs that will bring these people, build on their existing skills, and in a short enough time frame. And I'm not talking about 4 years, I'm not talking about 2 years, because the needs out there are today. We're not talking about doing something 2, 3, 4 years down the road. Healthcare vendors need help now. Hospitals need help now. Providers need help today. So the challenge is upon us as educators and practitioners of the field of healthcare informatics to come up with practical programs that can bring people up to speed in the shortest possible time. And that is doable. We have done it, and quite honestly, we have done it without any government support. Instead of waiting for, and although I think a lot of ONC and what the government has done, and their guidelines and their effort in this area, we basically put our head down and basically said, damn the torpedoes, full speed ahead. A year and a half ago, went ahead on our own penny, developed a program that has been quite successful. The pilot program that we did, 57% of our graduates were able to find employment in the field of healthcare within 3 months of graduating out of the program. And this next round of the program that we're doing, we have added some enhancements that hopefully we have raised the bar. Our goal right now is better than 85%. And considering the quality of the students that we have in the program, in this current class, for example, we have 25 students who would be graduating. If there are any employers who need great graduates of the field of healthcare informatics, I have 25 of them. These guys will be graduating by the end of December, and they are just amazing. At least all of these individuals were picked from a field of over 100 applicants that we had. Our class can accommodate only 25. And not only they know everything, I guarantee you, they know everything from A to Z of healthcare IT. And then in addition to that, they have been trained on a commercial system, on a commercial HIT system. All the HIT applications as well as all the EHR applications, they have been trained on. We were fortunate to partner with CPSI, which is a vendor that has installations at over 725 hospitals, mostly smaller to mid-sized hospitals around the country. And they allowed us to install their entire system here on campus in Atlanta. So our people, our students are basically get checked out intensively on these systems. And when they come out, not only they know the workflow, not only they understand the applications and their functions, and not only they speak the language and the terminology of healthcare, but they are also able to hit the ground running because they've been checked out on these practical systems. I have been talking to a number of CIOs around Atlanta, and they can't wait for this class to graduate so they can get hold of their resumes, simply because they know they don't have to retrain these individuals. One problem that the CIOs have today has to do with the fact that it used to be when they had more money and could hire individuals out of college, they could train their own. They have a lot of work, their budget has been cut, and they don't have the resources to train these people. So they have to bring in trained individuals. And that is where the role of the educational organizations needs to change, because in the past, educational organizations just basically train these people and sort of push them out of the door. Today, we need to basically look at the end result and say, all right, what are the skills that are needed? And also realize that these folks need to be parachuted in the middle of the battlefield. We are no longer recruiting people into Army to go get trained. These people need to parachute into the battlefield. And as a result, it's incumbent upon those of us who put these programs together to keep that in mind and put a curriculum together that addresses the specific needs of the healthcare industry and at the same and basically allows such programs to address the crucial issue of workforce shortage.
Well, thank you. I would love to take more questions, but I think we're just about out of time, and that was a great, kind of good recommendation for you. So there will be a break right after this, and if there are other questions, I'm sure the panelists can hang around. But I would like to get, one more point, from each of the rest of you. Dr. Gabi, thank you for that. But Dr. Hines, any other final words and any recommendations?
I guess our call to action,
yes.
Networking. Definitely keeping your skills up to date, learn something new wherever you are that can be transferred into any other industry. Take advantage of educational opportunities if you can. And there are several free opportunities out there to help you with HIT education. And take advantage of any opportunities you see to be an intern. It may not sound attractive to you initially going into it. It may sound as if you're taking a step backwards, but that internship can lead to a higher position or a new contact or a new reference for you as you move into a position that does work for you.
Great, thank you. Allana.
I think healthcare organizations really need to look to collaborate with those within their community, helping the rural access facilities, other providers within the community, and then also our support of what's going on from an education standpoint, offering those opportunities for internships to continue to cultivate our health IT professionals in the future.
Terrific, thank you. Dr. Foldy.
Yeah, and as we're trying to connect our disparate systems through health information exchange, many of us in this room are all trying to do the same things in very similar ways, but separately. And one of the thoughts I'm just having right here on stage, those kinds of impulsive things that a federal official isn't supposed to say. There are EHR vendors in this audience. You're all trying to solve the problem of hooking up with your state public health agencies. We have public health informatics fellows. In fact, we can't hire enough of them because we don't have enough money to hire them. You know, how can we make that kind of training opportunity both a laboratory for the learning of the public health workforce as well as a temporary workforce for solving the healthcare to public health connectivity problem over the next couple of years? Just a lingering thought.
Terrific. Well, listen, thank you all so much. I think the information you shared was very insightful. I appreciate your time. Thank you so much. Thank you.